Hello, I'm Norma Dalawi, a radiologic technologist and clinical coordinator. Today I'm going to walk you through the basics of radiation dosimetry, what it is, how it works, and why it matters to every healthcare professional, whether you work in imaging or not. Radiation is an incredible medical tool when used correctly, but like any powerful tool, it comes with responsibilities. Understanding dosimetry helps us protect our patients, protect ourselves, and stay compliant with safety regulations. Let's start with the basics. What is dosimetry? Radiation dosimetry is the science of measuring the amount of ionizing radiation a person absorbs. In diagnostic imaging, like CT scans, fluoroscopy, or X-rays, it's used to make sure we're delivering enough radiation to produce a quality image, but not more than necessary. In radiation therapy, dosimetry ensures that the tumor receives the prescribed dose while sparing healthy tissues. We use the gray to measure absorbed dose and the sievert when we want to factor in the type of radiation and its effect on specific tissues. Why dosimetry matters. Radiation can be life-saving, but excessive exposure, especially over time, can increase the risk of harmful effects. For patients, dosimetry prevents overexposure and supports safer imaging decisions. For staff, it helps track occupational exposure and ensures that we don't exceed safe limits set by organizations like the NCRP. This aligns with the ALARA principle, as low as reasonably achievable, which is the foundation of all radiation safety programs. Everyday radiation. Putting dose into perspective is important. A dental x-ray gives you about 0.005 MSV, less than a day's worth of background radiation. A chest x-ray is about 0.1 MSV, similar to 10 days of natural background radiation. On the other hand, a CT of the abdomen might be around 10 MSV, which is like 3 years of background exposure in one scan. This doesn't mean CT scans are unsafe. They're incredibly valuable. But it shows why dose tracking is important, especially for patients who need multiple scans over their lifetime. We measure dose using several tools. Personal dosimeters like TLDs or OSLs or electronic personal dosimetries track staff exposure over time. Dose monitoring software automatically records patient exposure during each procedure, allowing us to review trends and adjust protocols. Dose reports stored in the PACS or Radiology Information System, RIS, helps with compliance and auditing. Physicists may also use ionization chambers and phantoms to calibrate machines and verify dose accuracy. ALARA stands for as low as reasonably achievable. This is the cornerstone of radiation safety. We limit time near the radiation dose, increase distance because radiation intensity decreases rapidly with distance, and use shielding like lead aprons, thyroid collars, or mobile barriers to block scatter radiation. For example, doubling your distance from the source can cut exposure by a factor of 4, thanks to the inverse square law. Radiologic technologists reduce dose by carefully setting exposure factors like kVp and MAS, and by collimating the beam to the smallest necessary area. Avoiding repeats by getting the image right the first time is one of the simplest ways to reduce dose. We also use pediatric protocols with lower settings since children are far more sensitive to radiation than adults. Pregnancy is a special consideration. We always ask about pregnancy status and carefully weigh the risks and benefits before proceeding with imaging that uses ionizing radiation. Children require extra care because they have a longer lifetime ahead for potential effects to develop, and their tissues are more radiosensitive. We also monitor cumulative dose for patients who need repeated exams, like cancer patients or those with chronic conditions, so we can adjust imaging plans over time. If you're not in imaging, but occasionally help with patients during x-rays or fluoroscopy, there are simple precautions. Stand behind lead shielding, step out during the actual exposure if possible, and wear a lead apron if you need to stay in the room. Always ask the technologist where the safest place to stand is. They'll know the zones with the least scatter radiation. Conclusion. Radiation dosimetry isn't just a technical process, it's a safety net. It protects patients, it protects us, and it ensures the highest quality of care. Even if you don't work in imaging, you play a role in radiation safety. By following simple guidelines, asking questions, and staying informed, you help create a safer healthcare environment for everyone. Thank you for your attention, and I'm happy to answer any questions.